Hello everyone, welcome back to the channel. This is Dr. Nikhil here, an OBGYN resident working at KEM Hospital, Mumbai. And today I'm taking you inside one of the most exciting days of my residency, where I and two of my friends, Diksha and Mansi, attended an international conference called the International Endometriosis Conclave, which was organized by Mumbai Obstetrics and Gynecology Society, and this was held at the Grand Geo World Convention Center at Bandra. So this was a two-day conference which was held on the 14th and 15th June 2025, and the three of us did case presentations there as well. I had never presented at such a big stage before. The nerves were 100% and the stakes were huge. But what happened next? I didn't see coming. Come along as we experience the conference from the inside. So doing a quick outfit check before we head outside in the Mumbai rains. So we arrived at the Geo World Convention Center in the morning. We did our registration and we explored the place for a while. And while we were at it, we also had the delicious coffee that was being offered there. The place was buzzing. There were delegates from all over the country and the vibe was electric. Before we go ahead, let me explain you guys the theme of this conference, which is endometriosis. So endometriosis is basically a condition where the inner lining of the uterus, which is called the endometrium, which normally should be present inside the uterus only, ends up growing outside the uterine cavity in other organs. So it can involve a lot of organs in the body. Basically, it can grow anywhere in the endometrial cavity, on the ovary, on the uterosacral ligaments. So this conference was broadly based on the surgical management of this condition. There were videos relayed of live surgeries for endometriosis being performed by experts all over the country and all over the world. And there were presentations and discussions by experts on updates regarding the surgical management of the different types of endometriosis. Bowel endometriosis, bladder and ovarian endometriosis, robotic surgery, management via hysteroscopy and a lot of other cool stuff. The conference also offered the opportunity for residents and faculty to present any interesting cases that they might have encountered about endometriosis or to show any difficult surgeries along with the results. So my case was about a teenage girl with severe dysmenorrhea.
I present a case here of an adolescent with recurrent endometriomas managed successfully with long-term progestin therapy. Now the initial evaluation was done 2 years back when her symptoms had begun, and an ultrasound was done which revealed a 7.8 by 4.9 centimeter cyst with internal echoes in the right ovary.
Dysmenorrhea is a term for pain that is encountered during periods. So this girl had pain which was so severe that she could not even stand when the pain occurred. In order to get a better idea of how much the pain is, we often use something called as a visual analog scale, which quantifies the pain from a scale of 1 to 10, where 1 being the minimal amount of pain and 10 being unbearable pain. So this woman had a pain which was an 8 to 9 out of 10 on the visual analog scale, so it was very severe. On investigating and doing a sonography, she turned out to have a cyst in one of her ovaries. A cyst is basically a fluid-filled cavity which develops inside anywhere in the body, and in the case of this woman, it was a special type of cyst which had developed because of endometriosis. It is called an endometrioma or a chocolate cyst. So it is given this name because when laparoscopy is done for this kind of a cyst and it ruptures, the fluid that comes out is chocolatey colored. So basically what happens is that endometrium abnormally grows on the surface of the ovary and the body tries to form a covering around it, and this eventually ends up forming a cyst. Now specifically, actually it is not a cyst, it is a pseudocyst, because a cyst is lined by epithelial lining whereas this is not. Anyway, I'll not go into all those little details. This girl had a very huge cyst of around 7 by 5 centimeter, which should actually be managed by surgery according to most guidelines. But my case was interesting because this was managed successfully using only medical treatment and zero surgery. In this case, the woman was given an oral form of progestin, which is basically a form of progesterone, a hormone that is found in the normal human female. And this caused a massive improvement in the symptoms of the lady, and the cyst also reduced in size on sonography. I'll probably link down my presentation in the description below if you guys want to check it out. Oh, and my friends Diksha and Mansi also presented cases, and their case was mainly based on surgical management of endometriosis.
The main aim of my study is to investigate the outcome of women after surgical treatment of endometriosis in the form of pain by visual analog scale and quality of life.
Scar endometriosis is endometriosis present in operated scar tissue. Para-1 living one with previous one lower segment cesarean section.
Both of my co-residents gave amazing presentations, and I believe that we represented KEM very strongly at this conference. Residents from many other colleges also did presentations. So after the conference, we were discussing and trying to guess if any of us would win the prize. But for that, we had to wait till the next day. So we were quite nervous before our presentations, and after they were done, we just chilled out for a while and we took photos. So in medical conferences, there are stalls set up by the manufacturers of drugs, medical devices and instruments. And through these stalls, any new developments in the instruments or the devices are showcased. And often there are demos available for the delegates to try their hands on. So we stumbled upon a stall for an intrauterine contraceptive device called as Mirena or Mirena. It is basically a small T-shaped plastic device that contains the hormone progestin that is inserted directly into the uterine cavity. It releases the progestin hormone directly inside the uterus, and it is a form of birth control and can also be used to treat heavy menstrual bleeding. Here there was also a model of the uterus kept with the cavity visible that was available for delegates to try their hands on the insertion of the device. So for the insertion of the device, there is a specific technique that is to be followed. So we also tried out the insertion of Mirena and we successfully got it in.
Downward to this mark now. We can see the French fully open. To this letter towards the fundus.
We have got this cure we required this scan.
I will share the link by board.
There was also a lot of other cool stuff around. There was a stall for this new app called High Gallon, which is basically an EMR, that is electronic medical record app with AI inbuilt for medical professionals, which can be used to simplify the workflow for doctors. It offers features for patient appointment management, maintaining patient records, scheduling appointments, AI-driven patient summaries and whatnot. Good stuff. After visiting the stalls, we then headed out to have the delicious lunch at the venue. And after lunch, we attended one more session that was on updates in the management strategies for a disease called adenomyosis. So adenomyosis is another disease in which the endometrium, again, which should normally be present inside the uterine cavity, grows inside the myometrium, that is the muscle layer of the uterus. Now traditionally, if you ask any gynecologist for the definitive treatment of adenomyosis, it is just hysterectomy, that is the removal of the entire uterus. Of course, that is quite radical. But recently, new updates and new management strategies have come up for adenomyosis, which do not need to remove the entire uterus. And this was what was discussed in this conference. There were very interesting treatment strategies like treating the adenomyosis hysteroscopically by approaching from below and removing selectively only the diseased tissue without having to remove the entire uterus. There was even a technique that I found very intriguing in which the surgeon approaches the uterus laparoscopically, literally opens up the uterus like a lid, removes all the abnormal adenomyotic tissue and then closes back the uterus. That was quite wild. Anyway, after this session, we called it a day and then we left. Moving on to day 2. Unfortunately, we could not attend the second day of the conference from the morning itself because of our duties, but I managed to attend the evening portion of the conference, which had the valedictory ceremony and the prize distribution. The prizes were announced for the various categories. Then the prize announcement for the junior category of paper presentation began.
It just goes to show how many juniors have been enthusiastically presenting. So first prize,
I had won the first prize. Oh my god, this was actually a very big moment for me because in fact this was my first case presentation that I had done at such a major conference. And to win a first prize at my very first presentation was just something else. And guess what? Nancy ended up winning the third prize. Winning did feel very amazing, but more than that, it was the chance to present, to learn and to grow. I would like to make a special mention here of my senior at Rajawadi Hospital who helped me a lot with this case and how to go about it. And a huge shout out to my guide, professors and co-residents at KM for their constant support. I will never forget this day. And I didn't know if you noticed it or not, but the prize was there in the background all along. Okay, I think that's enough of show off now. Thank you so much for watching the video, guys. Don't forget to like, subscribe. See you in the next one. Bye bye.